Today, I'm going to demonstrate two different voice facilitating approaches. The first approach is called digital manipulation. Digital manipulation is an approach where the clinician applies finger pressure to the patient's thyroid cartilage in different ways to help with various problems. There are three different types of digital manipulation. Today, I'm going to talk about digital pressure for lowering pitch. This is typically used for males who have a higher fundamental frequency than normal. The clinician will apply digital pressure to the patient's thyroid cartilage while they produce a prolonged vowel sound. This pressure will drop the patient's pitch level. When the clinician removes their fingers, the patient will be asked to maintain the lower pitch. If they are able to maintain this lower pitch, they should continue to practice this approach to produce a lower pitch without digital pressure. I will now demonstrate digital manipulation for lowering pitch. The clinician will ask the patient to prolong a vowel sound. For example, E. As the patient prolongs a vowel sound, the clinician will apply slight pressure to the patient's thyroid cartilage, like this. E. When the clinician applies pressure to the thyroid cartilage, the pitch level will drop immediately. When the clinician removes their fingers from the thyroid cartilage, the patient is expected to keep that lower pitch. If the patient can do this, they can continue practicing their lower pitch. If it goes back to being a high pitch, they'll repeat using digital pressure. The next treatment approach is called head positioning. Changing in head position can be used to facilitate a better voice for patients with different types of voice problems. Types of head positioning include normal straight forward, neck extended forward with head tilted down, face looking up, neck flexed downward with head tilted down, face looking down, neck flexed unilaterally with head tilted either to the left or right while tilted face looking forward, head upright and rotated toward the left or right, and face looking in that direction. Examples of patients who benefit from head positioning include patients with neurological disorders affecting chewing and swallowing, patients with dysarthria affecting both speech and voice, and patients with vocal hyperfunction. These patients all benefited from different head positionings to help with their various difficulties. Another example is patients with unilateral vocal fold paralysis. They can lateralize their head to produce a stronger voice. When trying out different head positions, it is best for patients to produce the position while prolonging a vowel sound. When working with a patient on head positioning, I will begin by explaining the approach. This may sound like, sometimes changing the position of our head can improve the sound of our voice. The head can be tilted down, back, left, or right. Sometimes we can improve the sound of our voice by simply turning our head to one side or the other. No head position seems to help everyone. Let us try a few and listen to any changes in the voice we hear. I will tell the patient to prolong a vowel sound, such as E, while performing each head position. The positions are as followed. Normal straight forward, like this. E. The next would be neck extended forward with head tilted down, face looking up. E. The next one is neck flexed downward, held tilted down, face looking down. E. The fourth is neck flexed unilaterally with head tilted either to the left or right with tilted face looking forward. E. And last is head upright and rotated to the left or right, looking forward in that direction. E.